I do neuro-gastroenterology, and to explain that a little further, the gut is a muscular organ from the mouth to the anus, and it propels what we eat, helps in digestion, and keeps up our nutrition. When everything is working fine, we really don't think much about it. But there is a lot of very complex interplay between the nervous system, hormonal system, other effects, anything that can affect nerves and muscles that goes behind it. And those are the diseases that I take care of. 50% of patients who come to the GI clinic can have motility issues. 30% of Americans have reflux issues. 20% of Americans have constipation. 10% have nausea, vomiting. 5% have fecal incontinence, that they can't hold their bowels. And up to 2% have slow stomachs. That's a very large number of patients and things that can trouble them. With neuro-gastroenterology, we have the tools to evaluate. We can do endoscopy, which is patient is sleeping, sedated. We can put camera down to look at the gut. We have X-ray studies and some radionucleotide studies that can help see the motility and see how things are moving. These are exciting times for gastroenterology. We have a lot of tools and medications available to help these patients. We have procedures that can disrupt the floodgates, that can prevent movement, normal movement of things. We have medications that can help with this. We are working on something called gastric stimulators that can help patients with slow stomachs and long-standing nausea, vomiting. Along with medications for constipation, we have these vibrating pills that are now available that can help long-standing constipation. I have patients with what is called cyclical vomiting syndrome. That is long-standing vomiting for unclear reasons. We can help those patients sometimes with anti-migraine and anti-seizure medications. So many tools available to help this sick cohort of patients. Diet and stress both have a significant effect on the gut. It affects the neuronal input and output from the gut as well as hormonal. And it has a direct bearing on dysbiosis of the microbiota. That is, that it alters our normal bacteria, fungi, and viruses that are in the gut. And that can cause a lot of disease. There is a condition called gastroparesis. Gastro meaning stomach, paresis meaning a paralyzed or a slow stomach. It afflicts 2% of patients. Patients who have diabetes can often have this condition. People who have gastroparesis have long-standing nausea and vomiting. They are extremely uncomfortable. And the stomach that is not emptying appropriately can be helped by a gastric stimulator. These stimulators are placed with minimal invasive surgery, and they help emptying the stomach and taking care of the nausea, vomiting. Once the stimulator is placed, we can adjust the settings based on patient symptom response.